Welcome, and thank you for joining us today. My name is Ellen Wilson, and I'll be the moderator for this expert briefing for the media, which is hosted by the Johns Hopkins Bloomberg School of Public Health. Today's experts will address how to take steps to stay healthy as COVID and RSV cases climb and flu season approaches. The professors will also discuss the protection levels of vaccines for all three viruses and the efficacy of testing, ventilation, masks, and other preventative measures. First, I'd like to briefly introduce our speakers. Dr. Andrew Pekosz is a professor in the departments of molecular microbiology and immunology and environmental health and engineering at the Johns Hopkins Bloomberg School of Public Health. He investigates the replication and disease potential of respiratory viruses, including influenza, SARS-CoV-2, and other emerging viruses. Dr. Keri Althoff is an associate professor in the Department of Epidemiology at the Johns Hopkins Bloomberg School of Public Health. She uses large-scale longitudinal data to answer otherwise unanswerable questions and improve health, particularly for populations underrepresented in research. We will have time for questions following our speakers' remarks. We will take some questions that have been submitted in advance of the briefing and some directly from the Zoom chat. If you have a question, please enter it in the Zoom chat addressed to panelists and hosts. Please enter your name, media outlet, and question. We hope to cover as many as possible. Please note that the participants are welcome to use images, video, or quotes directly from the briefing, and that the content is for immediate release. Participants will be muted during this briefing and it will be recorded. Dr. Pekosz, please go ahead.
So the season for respiratory viruses is well on its way in the US and parts of the Northern Hemisphere. The biggest problem with influenza and COVID-19 vaccine efficacy is whether the circulating viruses match the vaccine being given. Many public health laboratories continue to monitor influenza and COVID viruses to see if they have changed or mutated in a way that makes them less sensitive to the vaccine induced immunity. I want to start by discussing what we know about the SARS-CoV-2, influenza, and RSV viruses circulating at this time. COVID cases and hospitalizations were rising, but they seem to have stabilized recently. For the most part, we are seeing viruses related to the XBB family of variants that differ from each other by a few mutations. We are seeing changes in the COVID viruses that we know will allow them to escape some, but not all, of the vaccine induced immunity. While we know quite a lot about the effect of these changes, we just can't predict when they occur, so it's very important to continue to monitor for these changes. The BA.2.86 variant, which is highly mutated in sites that are known to be the targets of antibodies that protect from infection and severe disease, is not spreading at a very fast rate, though it is present in many different countries and US states. RSV cases are starting to be seen in some parts of the US. Not much information on the sequences of the variants is available, but we expect cases in children and older adults to continue to increase for the next few weeks. Influenza is rarely being detected at this time, though there is evidence from the southern hemisphere, where their winter has already ended, that all three influenza strains have been circulating. No major mutations have been detected, and the influenza B virus that is circulating is one we call Victoria, and we have not seen its sister virus Yamagata since the beginning of the COVID-19 pandemic. All influenza vaccines have the Victoria virus in them. Dr. Althoff will talk more about the recommendations for vaccinations, but let me discuss how we think this year's vaccines match up with the virus variants that are currently circulating. The COVID variants are a good but not perfect match with the vaccine strain available this fall. We have seen this trend over and over again with SARS-CoV-2 variants. Variants emerge on a regular basis. They have one or two mutations in regions that are targets for antibodies generated by either infection or vaccination, and those variants increase in numbers over a few months. RSV vaccines are a great match with the viruses that have been recently circulating, but that is based on a very small number of virus sequences, so we really need more data to be certain about that. Historically, RSV does not change as quickly as influenza and COVID viruses do, so again, that is good news for the RSV vaccines. Influenza virus vaccine efficacy in the Southern Hemisphere was estimated to be very good, and the Northern Hemisphere vaccine has 3 of the 4 same strains in it. Since we are just seeing the first significant number of cases of influenza, we do need a bit more data before we can be more certain of the match. And it's important to note that influenza and COVID vaccines still protect from severe disease, even when they aren't perfectly matched to the circulating viruses. So things are looking good when it comes to matches between the vaccines and the circulating respiratory viruses.
Thank you, Dr. Pekosz. And now we'll hear from Dr. Althoff. Dr. Althoff, please go ahead.
We have a number of tools at our disposal for this season. So let's review. First of all, vaccines, specifically the COVID-19 vaccine. mRNA boosters from both Pfizer and Moderna are being distributed, and Novavax, which is a non-mRNA vaccine, is going to be distributed soon. It was approved just very recently. All of these vaccines are targeting the XBB family. There were reports of delays in clinics receiving mRNA boosters. Novavax, again, is not yet widely available, but will be soon. The federal government is no longer overseeing the logistics of vaccine distribution, so delays have and are occurring. Go ahead and check vaccine.gov to find a location to where you can access the vaccine. For COVID vaccine, individuals 6 months and older are eligible to receive the booster dose. If you have a child that's less than 5 years old and has never had a vaccine, they are recommended to receive more than 1 dose to start, similar to how we received 2 primary series doses when the vaccine initially rolled out. The government is no longer providing vaccines free of charge. However, if you have health insurance, these vaccines are to be covered by your insurance with no copay according to federal mandate. However, you may be charged a fee for administering the vaccine. Check with your insurance provider to make sure you are receiving the vaccine from an in-network provider. If you are uninsured or underinsured and you are an adult, the federally funded Bridge Access Program can help you get a COVID vaccine at no cost to you at Walgreens, CVS, eTrue North, and state and local health departments. Call ahead to inquire about the Bridge Access Program. Uninsured or underinsured children should have access to free vaccines through the federally funded Vaccines for Children program. Let's switch to influenza vaccine. Individuals 6 months and older are eligible for the flu shot. The influenza season can last through February or March, so get a flu shot to help protect you from severe illness in the months ahead. There are important options for influenza vaccine, like high-dose options for older adults. So talk to your provider or pharmacist to inform your decision on which vaccine to receive. RSV. There is a new RSV vaccine available for people ages 60 years and older. It is also available to pregnant individuals at 32 to 36 weeks of gestation. There are monoclonal antibodies available. These are not vaccines, but monoclonal antibodies are available for infants less than 8 months of age if the pregnant individual did not receive an RSV vaccine before the child was born. Children 8 to 19 months of age at increased risk for severe RSV illness can also receive monoclonal antibodies. Let's also talk about tests. So tests are another important tool. COVID tests are available, and you should probably have some in your home, particularly if you are anticipating gatherings, perhaps for the upcoming holidays, especially if those gatherings would include individuals who are at higher risk for severe COVID illness. The federal government will once again send you 4 free COVID tests directly to your house through the mail. Go to covidtest.gov to ask for yours. Next, think about ventilation. If you are hosting a holiday gathering or considering attending an event with a lot of people, remember that ventilation is important to reduce transmission. There are low-cost options to improving ventilation in your home, like simply opening windows. Also, think about choosing outdoor options when attending events, and parents encourage your children's schools to continue to maintain ventilation practices that became more common in COVID. Masks. Make sure you have some masks on hand. And I know that many people do not want to talk about masks, But let's think about a couple of scenarios where a mask may be very, very handy. First, what if someone in your household does come ill with one of these respiratory viruses? Masks can be an important tool to help reduce transmission within your own household. Perhaps you'd like to visit a loved one who resides in a care facility for older adults, and you want to reduce the likelihood that you bring a virus to your loved one into that facility. A mask can help you with that. If you have an upcoming healthcare appointment in the next few months, or you need to go to the emergency department where you could be in a waiting room with individuals feeling ill with a respiratory virus, you will be happy to have a mask then. And finally, if you're infected or become ill with any of these viruses, wearing a mask is one way that you can help protect others that you care about in your homes and in your communities. Finally, let's talk treatment. Antivirals are available for some, but not all, of these respiratory viruses. There are 2 antivirals available for COVID. They are both orally administered. There is also an in-hospital treatment that is available for those who become seriously ill with COVID. There is also oral medication that can be taken for influenza to help prevent more severe influenza illness. There are no antivirals for RSV. So if you become ill with COVID or influenza and you are at an increased risk for severe illness, contact your provider and discuss treatment options. So this is our 4th season with COVID and our 2nd season with transmission and illness burden from influenza and RSV reaching nearly pre-COVID-19 rates. We have so many tools to prevent illness this year, and particularly prevent that severe illness. Please make sure your toolbox is loaded and ready to go so that your household is ready for the fall and winter months.
Thank you, Dr. Althoff. Now we will take questions. If you have a question, please enter it in the Zoom chat with your name, media outlet question, and to whom you'd like to address your question. The first question for you, Dr. Pekosz, is a question from Kelly Pyrek at Healthcare Hygiene Magazine. Can you address considerations for healthcare workers if the proposed triple-demic of COVID, flu, and RSV come to fruition? How will this impact their ability to be safe in caring for patients if there are staffing, PPE, and resourcing challenges still lingering from the pandemic?
Well, I think we expect to see all 3 of those viruses circulate this year, just like Dr. Althoff mentioned. What we're hopeful about is that we won't see them all at the same time. However, we may see them over a prolonged period of time, and we've started to see that now. We've seen COVID cases now. RSV cases are ticking up a bit, but there's no flu. In a few months, we may be seeing more RSV with influenza starting to tick up. So respiratory viruses are very carefully monitored by many healthcare providers. And depending on the local situation, you might expect hospitals to actually put in place more safeguards, not only for their patients, but also for their hospital employees, because those healthcare workers, their health is at risk because of the number of people that they see, but they're also in a very sensitive environment where individuals that are immunocompromised or perhaps more susceptible to the severe cases of these respiratory illness are present. So I expect that local conditions will be dictating how hospitals and other healthcare providers will respond to the outbreaks this coming fall and winter.
Great, thank you. And for you, Dr. Althoff, a question from Deborah Bloomberg, who is a freelancer. Increasingly, medical professionals are choosing not to wear masks while treating their patients. Can you help patients understand what goes into doctors' and nurses' decisions not to mask when given their roles that are at a higher risk of contracting COVID-19? And as masking continues to be one of the most effective tools we have to prevent the spread of COVID-19 and other respiratory illnesses.
So clinicians are going to make their decisions about wearing a mask similar to how others in the community. I think the reporter points out a number of key points regarding what their exposure may be. It is important to recognize what the community transmission is, because of course that is where patients are coming from. And it's also important to recognize the decision making that a healthcare provider has. So If you are going to see a healthcare provider and you would like to be masked, that is definitely a decision you can make and wear your mask accordingly. I think for other healthcare workers, they will continue to decide until what we might see, as Dr. Pekosz noted, we may see masking mandates come back into healthcare facilities if community transmission or threats to staffing or hospitalizations all increase. So there are going to be a number of indicators that healthcare settings will look at and monitor carefully before making those decisions.
Great, thank you. And for you, Dr. Pekosz, here's a question from Dawn Hefner at ABC Philadelphia. Are the flu strains circulating in the Southern Hemisphere a good match for the vaccines here?
Yes, all signs indicate that things are a good match. In particular, one of the components of the Northern Hemisphere vaccine was updated, and that looks to be an even better match than what was used in the Southern Hemisphere this past influenza season. The only caveat that I always have is viruses change relatively quickly, and we can't predict when they change. So we're continuing to monitor that to make sure that what we're seeing sort of at the beginning of the flu season continues through the flu season, that we don't see any unexpected changes in the viruses as they circulate here in the Northern Hemisphere.
Great, thank you. And a question for you, Dr. Althoff, from Julie Landwehr at Health. This is the US's second year facing a fall triple-demic of sorts. Does disease prevention look different this year as compared to 2022?
So we do have updates to vaccines to help keep us safe. We're monitoring their match to circulating virus. And so that is probably, a small update, but very important to ensure that these tools are working appropriately. Between our vaccines, our mask tools, our ventilation tools, our treatment tools, the toolkit looks very similar. The important thing to note is that our population immunity does shift and change over time as we have accumulated more illnesses across the populations over the last few years. So that underlying susceptibility does shift and change. So it's important to make sure that everybody is using the tools that work best for themselves, their families, and their communities to keep everyone safe.
Great. And a question for you, Dr. Pekosz. How long does the protection for each vaccine last? And how does this translate into suggested timing for each vaccine to ensure maximum protection?
Well, the simple question is, now is the best time to get any of those three vaccines. You can get them in various combinations. You can get them one at a time if you'd prefer. You can get certainly the COVID and the influenza vaccine at the same time. That's been approved. So now is the best time to do that. The COVID and influenza vaccines protection lasts about 6 months from severe disease. The RSV vaccine does a little bit better than that. But again, even with all that information, now is the time to go and get your vaccine. COVID cases are still around, so that may be the first priority that you want. But I would then time an RSV and a flu vaccine immediately afterwards, but aim for October to be the month that you get all three of those done.
Great, thank you. And for Dr. Althoff, a follow-up to that, can older adults get all three vaccines at once?
They can. It is not contraindicated. The RSV vaccine is shared clinical decision making for the recommendation. What does that mean? That means that patients and providers should have a conversation for those 60 and above and discuss, were those individuals pregnant between 32 and 36 weeks gestation. A conversation with your healthcare provider is really important. And so all three can be administered at the same time, but during that conversation with your provider, specifically inquire about what they think the best management strategy is. The bottom line is that having the vaccine is definitely going to confer more protection than not having the vaccine or being unvaccinated. So if you need to get all three at the same time, do it. If you want to space them out and you're going to come back for those additional doses, please do so.
Great. And for you, Dr. Pekosz, should workplaces require COVID or flu vaccinations?
Well, all of that is very much dependent upon the individual workplace and the setting that's there. Certainly, there are many healthcare facilities that require their employees to have influenza vaccines. We may be moving to that in the future, but right now it really is dependent upon that individual facility and factors such as the risk to the patients, the risk to the healthcare staff, are all factored into those decisions.
Great. And for you, Dr. Althoff, how do you know which illness you have, and does that matter?
Um, it's very hard to separate these illnesses because, as we all know, there are so many shared symptoms across those illnesses. It is important to know which illness it is if you are seeking treatment, because you want to make sure that you are receiving the appropriate treatment. So if you have a COVID test at home, take that COVID test. That is a very low bar to understanding whether or not you have COVID. And with COVID, there is still a recommendation to stay isolated or at home for up to 5 days to make sure you don't become an agent of transmission out in your community. If it's influenza or RSV, oftentimes those diseases have different durations and people stay home as long as they're feeling ill. When you return and you're still feeling ill or you still have a little bit of a drip, go ahead and wear a mask, right? And protect others that are around you. But whether or not you have any one of these viruses, in order to really understand which one it is, you can COVID test at home. You can go into a doctor's office for influenza or RSV testing.
And following up on that, are there increases in hospitalizations this fall?
So right now we're still seeing a low level hospitalization that's related to any of these influenza-like illnesses. It's tracked for COVID, it's tracked for influenza-like illnesses. We're still seeing low levels of hospitalization. As Andy said, we are not seeing much flu. We are seeing upticks of RSV, and we know COVID is present in most communities. So as those viral dynamics shift and we see more illness from any one or multiple viruses at the same time, hospitalizations may change as well.
And just drilling down a little bit into the flu shot, Dr. Pekosz, is it more effective than the flu vaccines used in previous years? Is it a better match this year?
It looks like it should be a better match this year. And I'll emphasize, though, again, that even when it's not a perfect match between the vaccine and the circulating strain, there's a really strong signature of protection against severe disease and hospitalization and death. So, irrespective of whether you hear that these strains are a good or a bad match, still a great thing to go out and get that vaccine, the RSV, the influenza, and the COVID vaccine. And in particular, if you're in a vulnerable group that's predisposed to that severe disease from those infections.
Great. And Dr. Althoff, speaking of flu, how many workdays are lost each year typically due to flu?
So
And
there has
also specifically with each case?
So there has been a number of studies, even pre-COVID, where we really drilled down into the impact of influenza, just seasonal influenza. And we have estimates of almost 17 million workdays that are lost every year to flu. And that's an estimated cost of $7 billion in a year in sick days and lost productivity. Individuals with flu lose anywhere from 1 to up to 4.5 days of work. That's kind of the population averages fall in between there. So it is important to remember that influenza vaccine can help shorten the amount of time that you are out. It can help make your illness a bit more brief, and it definitely helps to protect against more severe illness that could result in a hospitalization.
Great, thank you. And of Dr. Althoff, moving to RSV, why does it only affect young people and older people?
It's a good question, one that I'm not sure we have all the answers to yet, but we do know that it is individuals who are younger and older are much more susceptible to becoming severely ill. Other individuals do get infected with RSV. It's just that we're not as susceptible to becoming as severely ill. So there are a number of issues related to immune status in the very old and the very young that are likely playing a role there. So that's why we have to be particularly important, and why one of the recommendations for RSV vaccine includes pregnant women. And vaccinating pregnant women can not only protect them, which protects their babies indirectly, but also through antibodies shared from mother to child.
And on the diagnosis side, do you have to be diagnosed by a doctor to know if you have the flu or RSV?
So we do not have at-home tests for influenza or RSV. Doctor's office do have rapid tests, and then they also have, many doctor's offices have the ability to send those out for more in-depth testing. So yes, you do need to seek a healthcare provider in order to have a test for influenza or RSV.
And just talking about just the rate of vaccines this year, are there fewer people getting vaccines? Is there shot fatigue? For either of you answering. Yes.
It's an important question, and we hope not, but I think it's reasonable to assume there's some vaccine fatigue out there. They have released some information through the middle of September regarding influenza vaccine administration. And it looked like up until about the middle of September, things looked very similar to how many vaccine doses were administered last year. So not a huge deviation from anything we've seen in prior years for the flu shot. I think the COVID vaccine, as we learn more about booster doses administered, that may be something where we do see fatigue, but hopefully not. So the vaccines are coming if they're not already in a community near you.
Great.
And maybe I'll
yes,
add,
please add.
I'll
Yes.
add one thing that, we're moving towards the COVID-19 vaccine being a very simplified and more straightforward administration, similar to what we've always seen with influenza and with RSV. And so a lot of our hope is that simplification of the messaging for the COVID-19 vaccine will help deal with individuals who are understandably confused about, should I get a booster? When am I eligible? Those types of things. An annual COVID-19 vaccine will simplify that message and hopefully resonate more with people.
That makes sense. So we're almost at time, and just inviting both of you to make any closing comments, any final words. If you could, we'll start with you, Dr. Althoff.
So let's get ready for this year and be prepared, not only for ourselves, but our households and our communities. We are still losing people as we did before COVID. We lost people every year to influenza and RSV. With the new RSV vaccine, hopefully we'll see reductions there. But we know what we need to do to help prevent that severe illness and not only protect ourselves, but our loved ones as well. So look at your toolkit, make sure it's fully stocked and ready with tests, with masks. Remember your ventilation practices, particularly if you're hosting this holiday season, and be well.
Great. Thank you. Dr. Pekosz?
Yeah, a little preparation right now will go a long way to making sure that you're able to respond to the fact that you're infected during this season. Spend a little time now understanding where's your pharmacy, where can you get tested for influenza and for COVID, and how quickly can you get an antiviral if you are positive, because the timing is incredibly important to the efficacy of those antiviral treatments. And of course, go out right now and get those vaccines, because prevention is always better than treatment. And the vaccines do work, they are safe, and now is the time to get them.
Great. Thank you both for your presentations and these incredibly helpful answers. We will email the links to resources mentioned today and shared in the chat. And with that, I'd like to say thank you again to everyone for joining us today.